So I'm going to introduce myself, introduce Lisa, and then ask Lisa to take it away. After just a couple of quick updates for the C3 program grantees. So my name is Ruth Schwendinger. I believe I know everybody on the call today. I get to do prevention with Prevention Network these days out of Lansing, which is exciting for me because my favorite part about working in prevention is supporting and encouraging individuals, and I get to do that now as a full-time job. So reporting aside, it's not my favorite part, just full disclosure there. But it's important that we do the reporting and we do it accurately and we do it in a timely manner, because that way we can ensure continued funding. We can also monitor and measure our progress and celebrate those successes. And that's really critical because when we're able to show the impact that we're making with the funding that's been made available to us, we're able to make a case for funding future projects. And so for that reason, this is really important when it comes to sustainability. And it's also a great opportunity to train a few new staff members or retrain, if necessary, in using the Michigan Prevention Data System, which is, the core reporting system used by the state of Michigan for many, many different programs. So on that note, if you have questions for me about the C3 program, anything like that, I think we would encourage you to put those in the chat box. Lisa's going to be monitoring that as we go through. We're also going to stop a few times for questions. So if you have questions that are really specific to your grant, it's okay to go ahead and ask those. We are recording this session, so if there's any concerns about confidentiality or information you don't want made public yet, put that in the chat box or email or call me privately in a separate context. So Lisa Coleman, it's all yours.
Thank you, Ruth. Welcome, everyone. So I think I have come in contact with most of you throughout my various meetings, but I want to introduce myself, Lisa Coleman. I am the prevention specialist for the Michigan Department of Health and Services Office of Recovery-Oriented Systems of Care, and I oversee all things prevention. Most recently, we also hired in a prevention analyst. So there's 2 prevention staff at the state, which is good news, because then we have more capacity to address prevention at the state level. This training in particular is in regard to the Michigan Prevention Data System. And as Ruth mentioned, many grants that we fund throughout the state enter prevention programs, their prevention activities into this data system. So I am going to let you know I will monitor the chat. If you have questions, feel free to put them in the chat. I also will have a couple of slides, one about maybe midway through-ish, and then one at the end that specifically I'll stop to take questions. And then if you have in the chat and I haven't addressed it pertaining to the information we're specifically talking about at the time, feel free to unmute yourself and or raise your hand, and I will call on you to ask the question. So I want this to be more of a conversation. I do have quite a few slides that I'll get through just because I want to get through the content of what needs to be entered into the Michigan Prevention Data System. But I also want to make sure that you get your needs met and that the discussion is rich and you get your answers out of here. Now, some of the stuff I can talk about at a state level, what the requirements are, but many of you are either funded through a PIHP region and or prevention network. And so there are a lot of specific questions that may need to be determined by your region. So if that's the case, I'll just indicate that and encourage you to reach to your region in order to get those questions answered. But before we start, is there any questions right off, or is there anything in particular that you want to make sure that we cover today? If there's something that you wanted to get out of today? Okay, not hearing anything, then I will go ahead and get started. So Ruth, if you want to go to the next slide, please. So I just wanted to start with a little bit of history of the Michigan Prevention Data System. It's really been in existence in some form since 2005. And it is, as Ruth mentioned, the primary system for data collection. The state started the system when we had the Strategic Prevention Framework State Incentive Grant, and then the system has just grown from there. In 2009 and 2012, we had a rewrite to the system. So as we learned more about what the state needed, what providers needed, what the regions needed as far as data collection, we revised the system to reflect those changes. In 2015, we created new PIHP regions. In 2014, we created new PIHP regions. And so the system was redesigned to incorporate those new PIHP regions. And then just last year in 2021, then Prevention Network was added as a region. Next. We talk about the purpose of the system. It's really for recording staff activity. We want to collect information about the recipient of services and then what type of activity that you're actually conducting. And it's designed to really, and this is kind of key because sometimes we're like, why doesn't the system do this or this or this? And usually the basic answer is because it's really designed for a state level collection and data reporting system. So we have at ORAS, we have specific information that we have to report back to the Substance Abuse and Mental Health Services Administration. And so in order for us to report back to them that they need, we created this system so that we could collect all of the information. So sometimes there may be system components that are out of our control to change because it doesn't align with the information that we have to send to our federal partners. And we'll kind of see some of those as we go throughout this training today. Next slide. So I just want to talk in general about eligible activities that go into the system. So we're really looking at direct service activities that are funded either wholly by your region or maybe in part. And to note that indirect services, so things that you might be involved in, maybe you're recording pre and post test, or maybe you're calling up a school to set up a time to come in and do services. Those types of indirect services are not entered into the system. Maybe you're involved in training. You're a participant in a training. That would be what we call indirect activities or services. And those activities would not be entered into the system. But if you are in direct contact with either the individuals that you're trying to serve or a group of individuals making decisions on services to be had, then those are the types of direct service activities that would go into the system. And it's irregardless of whether it's you're meeting with those individuals face to face or it's a virtual activity. And so even before COVID came about, our system guidelines allowed for virtual staff activity. We've certainly seen an increase in that because of COVID and many schools going remote, and other COVID guidelines that we're following. So we know we've seen an increase in virtual staff activity. We've changed a couple of the allowable activities, and I will go over those when we get to that. But for the most part, our system has always incorporated either face-to-face or virtual activities. So we want to think about the time that staff are conducting activities. And that's what this system is really designed for, to capture that staff time in those activities. So it's not necessarily an outcome or a product of the activity. So for instance, if you're maybe involved in a media campaign, we don't really count the media campaign in the system, but you would count any time that you were working with others to create that campaign. Another example is brochures. Like if you created a brochure, we wouldn't count the actual brochure, if you will, in the system. So that outcome or that product, but certainly this, if you were designing that brochure in combination with or in partnership with other staff at other organizations or with your coalition, then time spent designing that brochure with those other individuals would be counted in the system. And then last, just making a note that the system is really designed to capture individuals that are being paid to do services. So any activities conducted by an intern or an unpaid, volunteer, those activities would not be entered into the system. So these are just some examples before we get into actually the talking about what activities or how to enter the activities into the system. But these are some examples of the virtual activities. So if you're attending a standard coalition meeting by either phone or video rather than in person, yes, that would be considered an activity. However, as I mentioned earlier, if you're just doing a phone call to plan an upcoming training, no, that wouldn't be entered. If you're providing training, so I do want to make that distinction. So earlier I said indirect time, if you are a participant in a training, like today's training, you are a participant, you're not actually providing a service, but I am as the trainer. So if you're providing a training, that certainly would go into the system. And if it's virtual, like the one we're doing today, then that would definitely be classified as an activity that would be entered into the system. So maybe you're training your coalition partners or your school partners or whoever you might be training. If you're actually providing that training, then that would go into the system. The one thing that has changed because of COVID is staff time spent to pre-record an informational segment to be used for future sessions in place of face-to-face interactions is now allowed. So if you were many prevention staff during the COVID pandemic created either videos or webinars that they then posted on, YouTube, Facebook, some other type of social media. And the time that you spent creating those videos to be used for others. So it could be a parenting video. It could have been, maybe a youth information video, whatever that information was, the time that you spent to pre-record that segment can be counted as direct service because you're basically it's kind of like if you want to consider it, it's sort of like a training, even though you don't have actual participants at the time you're recording it. The idea is that you're recording this training or this informational segment that then is going to be used for others to view. And so before COVID, we did not allow that to be recorded as staff activity into MPDS. But since COVID, we have changed that and made the determination that that really is providing a service. And so you would be able to record that. Informational podcast, certainly. So if you're doing a live informational podcast, that would definitely be recorded. But if you're recording a podcast so that you can then, put it out on YouTube or wherever podcasts go, then certainly the time that it takes for you to record that podcast, you can enter into MPDS. All right, just want to check. Thank you. All right, so record keeping, this was really going to be, I kept this in here just to give you an idea that you will be required to have documentation that whatever activities you enter into the system, that you can verify and say, yes, I actually did those activities. So if you're doing a coalition meeting, they may require you to have an agenda or meeting minutes. If you're working with elementary students or high school students, then they might require you to have an attendance list of who was in attendance, or what day and time you did the activity, or who is an individual that can verify that says, yeah, they did this activity. So the PIHP region or prevention network, whoever your provider or funder is, they'll provide those specific guidance regarding any of the requirements that they have for documentation. So it may vary by region. And so if you're in if you service multiple regions, and so maybe you have a contract with Prevention Network and one or two other regions, the documentation requirements may be a little bit different. We are actually having conversations currently at the state level and then with the regions to determine, is there consistent documentation that we should be keeping across the board. Certainly now we're considering any reporting requirements that we have to our funders, and then Lara, the prevention license requirements, making sure that there are specific documentation that Lara requires in order to maintain your prevention license. So often those types of requirements are considered when the regions are considering like what documentation they are going to require of their provider network. And then this is just to note that depending on what level you are, you have different permissions into MPDS. So as a provider, you're really the service implementer. And so you have permissions to enter groups, enter activities. You also have permissions to pull reports on all of the data that you've entered into the system. And then your regional, so you're either your PIHP or prevention network is the regional coordinator. So they would have access to all of the providers within their region and the data that they've entered into the system. And then ORASC as the system funder, you would think that I have more access, but I can see all of your information, but I can't enter any information into the system. So I can't change anything in the system, but I can view and get reports from the system regarding all of the data that you enter in. And then MPHI is our system administrator. And so ORASC contracts with them to manage our whole system. So if there's any technical difficulties, then MPHI would be the one to contact for that information. If it's content related information, then I would start with your regional coordinator and they would be able to give you information. And if not, then certainly you can reach out to me and or your regional coordinator would reach out to me to gain additional information about content related questions. And so I just wanted to make a couple of distinctions in regards to the provider profile. So as you think about staff that you're going to be employing that may work in the prevention data system, there's two separate designations for employees. So the first one is a provider user. And so the user is actually someone who can log into MPDS and enter information into the system. So they can enter groups and activities, they can manage groups and activities, they can revise groups and activities, they can, in some instances, they can delete groups and activities if they have those permissions. So the user is really basically that, a user of the system. Where the staff person, so a provider staff person, is an individual who's actually providing the services or delivering the prevention-based activities and services. So as a staff person, your name would be in the system so that the the user could choose that staff person's name as conducting services, but a staff person doesn't have a user ID or doesn't have a password and can't actually enter the system. So you can be both. So a staff person who is conducting services can also be a provider user, which means that they can also enter services into the system. But as you're thinking about what your provider profile needs to look like, those are considerations you're going to want to make. So for example, some providers ask all of their staff to enter their own data into the system. So if that's the case, then each staff would have to be a staff person plus a provider user. But there are other providers that have maybe one or two data entry people. And so they might have one or two staff that is responsible for entering everybody. So maybe they have 5 staff on board or 5 employees that are actually delivering services, but only 2 of those staff, or maybe it's a whole different staff member. Maybe it's just one staff that does all the data entry for the organization. They would be a provider user and be able to enter the data. And so all of the staff would give that user all of their information, and then the user would enter the data into the system. So it's really up to organizations how they want to do that. I just want you to understand the distinction between the staff person versus provider user. So each provider user then is ID to use the system, and there's can't be any 2 identical user IDs. So if you are a staff or provider user that has multiple contracts, some of you may already know this, if you contract with more than one PIHP, you have distinct user IDs for each PIHP and then passwords that go with those IDs. So unfortunately, we haven't come up with any solution to that to date, because the region, in order for the region to have access to their provider data, then we need that provider data. That provider data is attached to the user IDs. So that's the reason for it. I know that it gets confusing at the provider level if you are working with more than one region. But just wanted to give you a little background information of why that is. And to date, we haven't been able to change that. And then each user ID will have their own password, which I think I'll get to in a minute.
Oh, I just wanted to share that for the program that Prevention Network is running right now, and for future programs, we are going to preface the user ID with the letters PN for Prevention Network to make it easier for you to keep track of separate user IDs and login information.
So, and Ruth, I just want to, this is Nicole Flickma, just clarify that. So if we do data entry for our PIHP, and then are doing data entry for the capacity building grant, we will have two separate logins, and yours, the Prevention Network grant one, will start with PN. Right?
Correct. Yes.
Okay, thank you.
Yep, and the Prevention Network or the PIHP is responsible for giving you, because they set up the user ID in the system. So they'll be responsible for sending you what that user ID is.
Hi, I'm Priscilla with Coalition for Urban Youth and Family Development under Mr. Arbuckle. So you're saying after this meeting today, we'll be given a separate PN MPDS ID?
So
Yeah, I don't know.
yeah.
Yeah, at some point Ruth will be able to administer those.
Like, so I have one for CUIFT for under Mr. Arbuckle, but that's for stuff that goes on with the center. But the stuff that goes on for the special grant, the C3 grant for Prevention Network, you're gonna give us a specific ID to put those activities that we worked on.
Yes.
Okay, after this or like in the next 7 days?
We've requested a list of user names and staff names already through an online form. If you are not on that, by next week, I'll be reaching out to C3 grantees individually. to get that
Okay, yeah, I submitted mine last night with that grantee ID. There was like 4 questions. I
Okay.
submitted it. I didn't know if you had like access, because I didn't get like an email saying, oh, I just received it at the end saying, oh, it's been successfully submitted, but I didn't get an email confirmation saying we got it.
Thank you, Priscilla. It will be a few days before I get all of the users and staff entered into the system. All of the coalitions are already entered as providers. We just need to add the users and the staff.
Okay, one more
question.
question,
Thank
then
you.
I'm done. What do you want us to start? It's February. Are we starting to put activities in there for February 1st for this month, or we're doing this meeting so we can start for March 1st?
We are going to ask people to report proactively. So based on when any activities that we've funded so far with the grant need to go into MPDS when they are eligible activities. So according to the requirements and what Lisa's already gone over, as well as what she's going to continue to tell us about.
Got it. Thanks, guys.
I have one quick question. This is Amy in Tuscola. If we already use the MPDS system for our work, do we have to duplicate? So when I do C3 work, I have to produce it onto my own timesheet and put into MPDS. Do I have to do that? Are they going to have access to that activity sheet, that MPDS login to Midstate?
No.
So I have to do it in both MPDS logins.
So we're not funding
No.
your staff with this program,
Right,
Amy. So
right.
you would not report that with the PN as a provider.
So I will only report the PN for the activity that the coalition does.
You are only going to report on the PN login, those activities which are being reimbursed by this grant,
Oh,
which in your case does not include staff time.
okay. Got it.
Good questions.
Yeah, so that is a good question and a good point to make. If, as Ruth kind of alluded to, which I'm thinking if I'm on the right track, let me know, Ruth. But if you are actually using the C3 dollars for expenses other than staff time, you would not enter anything into MPDS system.
Only the activities that.
Yeah, so the only thing that is entered into the system is if you're paying for staff time. So if the C3 program, if you're saying, okay, we're gonna have 2 part-time staff do, I don't know, 100 hours a year or something. I'm just giving an example. Then those 100 hours of that staff activity would go into the system. But if you're using your grant to only buy supplies and materials, then you wouldn't enter anything into the MPDS system.
That's exactly what we were, yes, that's, so if we're not paying somebody, then we, outside of we're just not paying anybody, then we don't need to have a separate login. We don't need a PN.
Right, and yeah, PN would work that out with each individual contractor on if they need to enter information into the system or not. But the system is only designed to collect staff time in activities. So if we're not paying, and what there's a, as you will get to eventually, there's a spot for funding source. And so depending on who's funding you to do those activities, is the funding source that you choose to actually indicate this activity goes towards this funding source. But if you're not paying for staff time, if the C3 grant is not paying for staff time, then nothing would be added or entered into the MPDS system.
And so those activities would just be logged like on the monthly reports and tracked in a different way. Just staff time is being tracked through MPDS.
Yes.
Correct.
Okay, thank you.
Yep. Thank you. That was a great conversation and great questions. So next, this is just giving an overview of once you're in the system, some of the icons and those definitions. So if you have a little magnifying glass icon, that's if you can view information wherever that's at, you just click on that and then additional information will be shared on the screen. The plus sign is if you're adding something, if you're adding a new item, you'll click on that plus sign. If it's item that's deactivated, you'll see the thumbs down. If it's an item that is activated, then you'll see a thumbs up. If you want to delete something, you'll see the red X, and then you'll see a red lock if the information is locked. And so especially now we've finalized like last fiscal year's information and we've locked that information. And so if you try to, you can still have access to view and pull reports from previous data, but you won't have the ability to go in and edit any of the previous data once it's locked. So if you see that lock, that's what that means. And then I just want to make note of the provider user manual. This is available in the MPDS system itself. So on your dashboard, there is a link to the MPDS provider user manual. And it has so much information. It's really lengthy, I understand. But most of the questions that you have can probably be answered in that from that manual. It has tables that includes definitions, examples, etc. So it's pretty thorough on what is required to go in the system. It gives helpful hints about what to do or not to do in the system. So if you haven't used it, or if you have new staff coming on, that's certainly a must read. At least that's what I'm pushing for providers to actually read that manual and use it. It gives so much helpful information. So just want to, in general, about MPDS data entry, giving some general guidelines. Groups, if you're entering a group, it really, the groups define the elements of a series or a one-time event. So under the group section, you'll see that you can have either one-time groups, ongoing other, or ongoing sequential. And so depending on which group you choose, then you'll enter all of the elements to describe what that group is. And we'll get into that in detail in a minute. Activities then are attached to the group. So you cannot have an activity outside of a group. If it's a one-time group, then you'll have one activity attached to that group. If it's a group that has multiple sessions, then you'll have multiple activities attached to that one group. And there is a validation matrix that is at the end of the provider manual as an attachment. It is rather overwhelming So I don't expect you to know it all, but just to know that there are some validations that are in the system. So if you're trying to choose different components and it's not allowing you to choose the one that you want to choose, it's probably because of the validation matrix and you've miscoded something. So instead of trying to fit, what's the next best thing, make sure that you're reaching out to your regional coordinator to ask them, hey, how should I be entering this group so that I can enter all of the correct components. There's also a Youth Tobacco Act chart. So it's not pertaining to the C3 grant, but certainly if you are involved in other activities related to SINAR, then the Youth Tobacco Act chart is very helpful in recording those activities. And just so as I noted earlier, both the regional coordinators and providers have the ability to enter groups and activities. All right, so I just want to have a couple of breaks throughout to answer any questions. I know we've had some. Is there any further questions about just kind of more of this general information that I shared before I get into actually the login information and how do you enter data into the system?
No, but this helps a lot. This helps a great deal.
All right, good. I'm happy to hear that. Okay, well, hearing no questions, again, if you have them as I'm talking and find a spot to interrupt me or throw it in the chat and I'll make sure that I answer those questions.
Lisa?
Yep, go ahead.
I just wanted to say that book is like a Bible for us, for the MPDS system. So I encourage you to really read that.
Yes, thank you, Doreen. It is a Bible to me as well, because anytime you guys have a question, I open it up and I'm like, okay, what's the answer? Oh, here it is. Because of course I want to be consistent with what we're saying in the manual. So I don't think there's any question that I haven't answered that I haven't gotten the answer directly from the manual. So I appreciate you giving me a shout out with the manual, Doreen.
Yes, I can attest to that too, Doreen. We've been doing it for over 10 years. And I like those 3 pieces of paper I keep next to me because you got to know the strategies and categories and codes. If I have, that's like the Bible. That's all I need.
Yes. And also it just helps, especially if you're, if you're onboarding new staff, like those codes, activity codes are like priceless because it helps you determine what activities that you're actually responsible for doing. And so it's a great way to onboard new staff is to make sure that they are reading that user manual to get information that they are going to need to do their day-to-day job. So yeah, cool. Thank you for sharing that. All right, so we're going to dive in. First thing that you want to do, of course, is open your web browser. Here is the system address, mpds.sudpds.com. Do not include a www. I don't know, I think that takes you somewhere weird, but not to this system. So once you get to the system, you're going to type in your assigned username and type your password. To note, the password is only known to you. So what will initially happen when Ruth or other prevention coordinators enter your username or set your username up into the system, then you will get an automatic generated email from the system itself that says, hey, you've been entered to the system. Here's your temporary password. So once you put in your username and your temporary password for the first time, then the system will automatically say, hey, you need to change your password. And then you'll change your password into whatever password you want. So that password is only known to you. Not even the system administrators, so the MPHI, they don't have access to any password. So if you forgot your password, you just click on forgot password. Or if you want to change your password, there's not really a way to change it except to click on forgot password, and then the system will allow you to change your password. And then it's navigating the system. You will have a dashboard that looks, I think, mostly like this. There may be a couple of things like the managed PA profile. I'm not sure if you have that, because depending on your permissions is what your dashboard looks like. But you'll definitely be able to view groups, enter groups, view activities, enter activities. And then you have your reports as well. View notifications, I'll just make a caveat that that really isn't used as much. Initially, it was designed for regional coordinators to send information to all of their providers. And, whether it's like an update of something that might be happening with the system, or maybe information about entering system, maybe a due date changed, or whatever the information that they wanted to get to you may be. And then you could go into view notifications, and the providers would be able to see the information that was shared from their regional coordinator. However, the system doesn't automatically let providers know or users know that there's a notification. And so sometimes, providers might not have went in for, 2 weeks later or something.
Sorry, Lisa, we lost you. You're muted there for a second.
Oh, okay, sorry. That's why I said on. All right, so I was just saying the view notifications, we're not really using that as much. It was designed, how it was designed was a great concept, but because it doesn't notify users that there's information in there, then you have to you'd have to go on a daily basis almost to go in there and look at it. So most of the regions don't use that. But if they do, then they will give you requirements on how to do that. And then the provider user manual is, like I said, in the system. So you just click on that and you get that. All right, so, excuse me. Assign, so the regional coordinators will assign user names. So Ruth, so if you are contracting with Ruth for the C3 grant, then she will provide your organization with the username based on who you've identified needs to be a user of the system. So once she has that username, then she will send you those usernames at some time in the near future. All right, so let's dive in. So we're creating groups. You will see on your dashboard. So on your dashboard, at the top of your dashboard will be different tabs. So it's basically the same tabs that were the icons that were on your dashboard. So if you want to add or to create a group, you would go to groups, and then you'll see that you have three tabs will appear: either add a group, view all groups, or find a group. So in order to, if you already have data in the system and you just want to find a group, you would click on find a group, and then it'll say, ask you for the criteria. It'll have a drop down of, finding different groups, and you'll be able to follow what they're asking you to do in order to find that groups. If you want to view all groups, when you click on that, all of the groups that you have entered into the system for your organization will pop up, and then you can click on any of the groups that you might want to view. But today we're talking about creating and adding a group. So you would click on add group. Next slide. So this was, should be what comes up on your screen, and we'll go through some of these components. But the PIHP region will automatically be displayed, and the provider agency will automatically be displayed. And then you'll want to talk about, is there a group name, what that might look like, and we'll get into that a little bit more. And then, you know, is it Youth Tobacco Act related, yes or no? It'll automatically default to no. Group type, program type, all of these different information is, and we'll go through them each individually on the next slide. So adding groups for the group name, you will create that name. Either the PIHP or Prevention Network may provide protocols for establishing a group name. So some regions have specific protocols on how they want you to name your groups. So you just need to make sure that you're following whatever they're asking you to do. The program name is a drop-down menu with pre-selected options. So as you've seen before, a lot of the, in the previous slide, a lot of the information had arrows. So anytime you see those arrows, that's the drop-down menu, and you'll click on that. So program names are put into place by your regional coordinator. So Ruth would be responsible for creating a list of all the program names that she wants in the system. And then when you go and enter group information under Prevention Network, that list will drop down. And so then you'll have a choice depending on how many is on that list. It could be 5 programs, it could be 10 programs, but you'll pick which program name or which program that you're, or service that you're actually conducting. And then you'll just click on that program name from the drop-down menu. For this purposes of this grant, the C3 grant specifically, the SINAR or YTA related would be no. So you're not doing anything to that. If you're contracting with a PIHP region and you are actually responsible for doing SINAR or Youth Tobacco Act related activities, then you would put yes. The same for gambling prevention. So if you're being funded specifically for gambling prevention program, then you would switch or click yes to that question. But again, for the C3, neither one of those pertain. And both of those will default to no automatically. So if you are doing one of those services, then you have to manually click yes. So these are the group types that I mentioned earlier. The one-time group is really if you're doing like a one-time presentation, or maybe you're going out to a health fair to disseminate information, and it's like a one-time activity, then you would choose the group type of one time. And as I mentioned earlier, if you choose one time, then once you enter all of the components for that one-time group, go to the activity screen, you'll enter information for the activity, and then once you add that, then that one-time group will be completed. So you can never go back and add additional activities to a one-time group. You only can add one activity. Ongoing other groups are groups that don't necessarily have a sequential set of sessions. So examples of ongoing other groups would definitely be like your coalition. So if you have multiple coalition meetings, then you would choose ongoing other for your coalition. If you are doing maybe even maybe a parenting or a life skills program that's topic based, so maybe there's like 8 topics that you cover for that program, but participants can enter on any of the 8 topics. So maybe they come in on session 5 and then they go all the way to session 1, then that would be considered an ongoing other group. But if you're doing a curriculum-based group that has sequential sessions that typically add on each other, then you would pick ongoing sequential. Program type, you would click, so this is based on thinking about the services that are being provided are activities designed for the individuals you are working with, who you're trying to maybe change their behaviors or their skill set or their knowledge base, then you would choose individual. So many of like your educational curriculum, so your maybe then life skills or Prime for Life, or even your family programs like Strengthening Families or Families in Schools Together. Those are all individual program types. Population really talks about activities where you are not directly working with the individuals whose behaviors you're trying to impact. So population type might be for your coalition. So you're working with your coalitions to actually change someone else's behaviors. So maybe you're trying to implement programs to address underage drinking, or implement programs to address, college aged marijuana use. So if you're working with like coalitions, then that would go under population type. And if you have a question about which should we choose, individual or population type, make sure that you're asking your regional coordinator what would be the best the best program type, because based on your program type, there are other validations in the system. So if you choose individual, then you have different options in other components versus if you would choose population. So again, if you choose one and then you go through some of the other components and what you are really doing isn't there, then you need to step back and decide, okay, which one of the program type is it really individual or is it population? All right, and then you'll have a minimum and maximum number of activities. So this is going to go along with your ongoing other and ongoing sequential activities. The one-time activities, this will automatically default to 1 as your minimum number of activities. So the maximum number of activities is really determined by you, the provider. So if it's coalitions, maybe you're going to say, okay, we're going to have 30 coalition meetings throughout this year. So we need space to enter 30 activities. Or maybe you're doing then life skills and there's 12 sessions that you're doing. So then you'd say the maximum activity number is 12. Just to note, you can change that maximum activity number at any time. So if you're involved, let's say your coalition meetings and you're like, oh, we're going to have 20 coalition meetings. And then, it comes closer to the end of the fiscal year and you've actually did additional coalition meetings that you weren't anticipating and you're already at your 20, no need to worry. You can go back into your group setting and revise the maximum number and change it to whatever it is that you need it to be, 25 now or 30 or whatever it is. So the intervention type, this you will enter in the system. This also goes hand in hand with your populations that you choose. So you will see in the manual, there's actually a chart that has a list of all of the prevention populations, and then it'll say what intervention type that goes to. So sometimes if you're not sure of what intervention type, you may want to go to what population are you servicing and then look to see what intervention type that is related to. So indicated, but in general, indicated means that you're really targeting individuals based on their risk. So indicated population services are with those individuals that maybe are already using some substances but they don't yet have a diagnosis of a substance use disorder. But they're at definitely high risk of developing one because they're indicated because they're at higher risk. Sorry, a question popped up. And so then I lost my train of thought. Oh, this is fun. All right, thanks for bearing with me, y'all. So anyways, indicated population or indicated interventions are really designed for those individuals that are at highest risk, either because they're already experimenting and using, or they might have other biological markers that make them at higher risk. Selective are those individuals or a subgroup of the population whose risk of developing a disorder is significantly higher than average. So looking at what individuals are you servicing, what type of risk do they have? And again, if you look at the population types, that'll help you determine who should fit in that selective category. And then universal direct are interventions directly served to an identifiable group of participants who have not been identified on the basis of individual risk. And so universal direct is really more broader, so you can service anyone. It's not based on individual risk, but you're working directly with that individual. So it may be a Botman life skills program that you're doing with a whole 7th grade class. That would be universal direct. But if you're doing universal indirect, is if it's a population-based program that's really more environmental and looking at environmental strategies. So maybe you're working on establishing alcohol, tobacco, and other drug policies, or you're working on advertising practices. These interventions really involve programs and policies usually implemented by coalitions. So a lot of your universal indirect is going to be based on the coalition work that you do as well. All right, I'm just going to take a quick pause. We had one question. Can you give an example of population types? Can you go back to the population type just so I can? Okay, so is this, okay, so the program type population, is that what the question is regarding?
So you were talking in this slide about the intervention type being dependent on the population category. And so we haven't seen an example of those different population categories. And I wonder if you could give us some examples of that.
Sure. So I do have that later on, but we can jump into it right here. That's a good thought. So some of the population categories in the indicated are people who are already using substances. Let me see. Persons that are in recovery, but maybe they're not currently in need of treatment would go under indicated. Selective populations would be individuals that are either physically and emotionally abused, pregnant, and women of childbearing age. It could be a school dropout, people with disabilities, people with mental health problems, homeless or runaway youth, delinquent, violent youth, and also children of parents with a substance use disorder. So all of those would fit under your selective populations. And then so more of your universal populations are going to be more general. So as I gave an example, it might be students. So all of the students that are in a 7th grade classroom. So you're not necessarily choosing those students to be a part of your prevention programs based on individual risk. It could be older adults, maybe more universal, although we do have some data to support where older adults, you may even consider them in the selective area if they're have a higher risk of developing a substance use disorder. But in general, like if you're doing work with business and industry, if you're doing your coalition work, would definitely go under the universal. And then if you're really examples of populations for universal direct might be any of those populations that you're, like I mentioned, you're doing services with directly. So if you're working with parents and families, they might be a universal population. And if you're working with them directly, then it would be universal direct. But if you're working with your coalition to do other services, then your population would be coalition, but it would fit under universal indirect because you're not trying to change the behaviors of the coalition, but you're working with your coalition to help change behaviors either in the community or change community norms, that type of stuff. So that would fall under universal indirect. And there's a chart in the manual that gives you right here. So the service population. So it gives you all of the service population categories in the chart. And then it has the name, and then it gives a description of the category. So for instance, there's a student population, and there's also youth/minors population. So then it gives you a description so you can decide, okay, which one actually would fit the best based on who I'm servicing. So would it be students who are youth enrolled in public or private schools, or would it be youth minors, which are children under 18 who might not be counted under any of the school grade categories? So maybe you're doing something outside of the school setting. And so you're defining them as youth or minors, even though they may be students at a school. So the chart in the MPDS helps you determine which population based on the description you really should be using. And then of course, as I mentioned in that chart, it also has the intervention type. So if you choose selective intervention type, only those populations under selective will come up. So if you get to your population and the population that you're servicing isn't available, then that's an indicator that, oh, I must have chosen the wrong intervention type. And so, excuse me, you'll need to go back and make sure that you change that intervention type. And then the service domain, honestly, out of all of the information that's entered, I don't know if I should say this, I am being recorded, but truthfully, out of all the information that's entered into the system, the service domain is probably the least needed. And I say that it's not used as much as it was previously. It's certainly helpful information, and we do have to report some information regarding the service domain. But if you make a mistake and you click one service domain over another, it's not the end of the world. We'll still be able to get the information that we need. But even saying that, obviously we want to have as the accurate information as we can. So as you think about the service domain, if you're working with individuals, these are services designed to impact an individual person knowledge, skills. And so then you would choose individual. So if you're doing like a life skills training for youth, then that would be individual.
You never sent me like a Zoom link. There was just like a Google link.
Oh, okay, thank you. All right, so then there's also the family. These services are designed to improve family functioning. So this domain, if you're teaching a parenting skills program, would go under family, or if you're doing a group family program, so something like strengthening families, then that would go under the family service domain. The peer domain, I think, is the one, at least for me, causes the most problems to understand. And for me to understand, but it's really the peer is if the services are designed to influence peers. So maybe you have a peer mentoring activity that you're doing. Maybe you're working with high school students and they're mentoring either their peers at the high school level or even maybe middle school students. Then that programming would go under the peer service domain. School work would be, are the services or activities designed to change either the school or work environment? So one example I can think of is if you're having, I think it's called Caring Schools Community, that would, you're trying to change the environment of the whole school. So that would go under the school work service domain. If you're trying to change school policies or work policies or work environment, then that would go under the school work service domain. And then the community is really where most of your coalition work probably is going to take place in this domain. It's really designed to change the way in which a community and its systems function. And then society environment is designed to change the environmental conditions. So if your coalition's efforts are to change public policy, maybe your activities, to reduce access to substances, maybe you're doing media campaigns to change community attitudes or beliefs, all of that then would go under the service domain of society or environment. And then this is just the funding source that I mentioned earlier. It'll be a drop-down menu. So this is the current menu that's in there, that's in the MPDS system. But just to note that it may change. So you'll see that there's missing numbers, and that's because some of the funding sources that were in the system are no longer active. And so we've taken that off the list so that they're not inadvertently chosen. So, and if some of you have been in prevention a while, may say, hey, we noticed some funding sources on there right now that probably are completed. And so we're in the process of eliminating some of those funding sources, because what has happened is that inadvertently providers have chosen a funding source that is no longer active, or no longer, funds aren't available anymore for that funding source. And so we're helping them change those to the correct funding source, so that we can then delete the inactive funding sources. So you won't be able to see them. So for this grant, this will be in, Ruth can give protocols and procedures in regards to this too. But for the C3 grant, that is COVID supplemental block grant, or 09. So you would, anything that you do for C3 program, then you would choose 09 COVID supplemental. If you're funded to do a different program with a different PIHP, then they would direct you on what funding source that you need to choose for the activities, groups and activities that you're entering into the system. Evidence-based service type. Again, you'll also want to check with your regional coordinator to make sure that you're choosing the correct evidence-based service type. But in general, the National Registry of Evidence-Based Programs and Practices, or NREP #1, That was previously funded by SAMHSA and is no longer being funded by them. However, there's many programs that were listed on NREP as being evidence-based. So if you have a program that was previously listed on NREP, you can continue to choose that evidence-based service type for your program. If you have a program that's maybe on a other federal list, perhaps it's through either NIDA, the National Institute on Drug Abuse, or maybe the Office of Juvenile Justice and Delinquency Prevention. Maybe there's a list through the Department of Education, then you would choose other federal agency for your evidence-based service type. Peer-reviewed journal, this is if the program that you're implementing, maybe it hasn't gone through, maybe it's not on one of a registry list, but it has been in peer-reviewed journals and shown to have positive outcomes. And then local PIHP evidence is really looking at, is there local regional evidence? And there's criteria that you have to follow in order to pick number 4. So if the intervention is based on a solid theory, if the intervention is supported by a documented body of knowledge that's generated from similar or related interventions that indicate effectiveness, and third, if the intervention is judged by consensus among informed experts to be effective, then you can choose number 4. So number 4, you really want to check with your local or your regional coordinator to make sure that you can choose number 4 for your evidence-based service type, because they will need to have documentation that it meets those 3 criteria. CBP stands for community-based process best practice. And so again, that's really going to be your coalitions, your task force, your group meetings your collaborative activities are going to fall under those best practices if they meet the criteria. 1, the project is conducted using community-based process. 2, the collaborative has substance abuse specific measurable objectives. And then 3, the collaborative process is compatible with the 5-step prevention planning process, which we call the strategic prevention framework. So it includes assessment, capacity building, planning, implementation, and evaluation. So if they meet those criteria, then you would pick CBP best practice. Again, specifically for the C3 program, you won't have any Youth Act or SINAR programming, but if you work with other PIHPs to do any SINAR related activities, then you would choose number 6 for those activities. And then if it doesn't fit any of the criteria above, then you would choose number 7. Currently, the state has recommendations that up to 10% of funding can be used on evidence-based service types that meet none of the above.
I stepped away for a hot second and
Yep.
I missed the discussion before this regarding funding source. So since this is specifically for Prevention Network C3 grant, which one would we choose?
So this one is COVID supplemental block grant, so 09.
Thank you.
Yep. So primary strategies employed, we talked a little bit about this earlier. As far as that, there's a whole list of strategies that are in the system. It'll be a drop-down menu that you'll be able to choose from. And the primary strategies are based on the Center for Substance Abuse and Prevention strategies, which are alternative, community-based, education, information dissemination, problem identification and referral, and environmental. So within the, I'm not going to go through each of them in depth, but certainly you'll want to look through the table that's in the MPDS manual that gives a list. So in the table, it describes the primary strategies. And then underneath it, it has various strategy codes that are attached to that primary strategy. And so it also gives the code description and then the purpose of the activity and examples of the activities. So this is where I get a lot of questions. Most of the questions that are actually asked can be found in the manual in these code descriptions and examples of activities. But if not, there are sometimes activities that might come close or might be similar. So we do know that the strategy codes, I don't think are all inclusive of every single activity that we actually perform as prevention staff. So sometimes we have to say, okay, what's the best fit? And that's okay, because we have to, the data is based on, again, what we have to report to SAMHSA. So some of the information that we aren't reporting to them, we don't allow that into the system currently. So there's always conversations about how can we open up, are there other strategy codes that maybe we need to include at some future date? So as you go through your programming, if you truly are like, man, I'm doing this activity and I truly can't find an activity code that goes along with it, please make Ruth aware of that and she'll let me know, because I try to keep track of that to see if for future reporting periods, is there a way that we can, add a code if a code truly exists. But in the system that we have now, you would just choose the most appropriate strategy code based on the activity that you're conducting. And if you get stuck, then certainly reach out to Ruth to see what primary strategy that she wants you to employ, and she can certainly engage with me as well to make that determination. All right, so that was kind of the group screens. When you finish entering all of the data into the group, it'll have, I think at the bottom it says either add group, save group. I'm not sure. I think it says add group. So once you click on that, it'll automatically direct you to create an activity associated with that. And as I mentioned, if it's a one-time group, you're only allowed to add one activity to that group, and it'll automatically go to the create activity. If you are adding additional activity, if you need to add additional activities, we'll show that in a minute. If it's like an ongoing other or an ongoing sequential group, then you do have the ability to add additional activities. So we'll go through this creating an activity, and then it'll be the same thing if you wanted to add an activity at a later time as well.
Lisa, real quick.
Go ahead.
I had somebody send a comment that it seems kind of overwhelming to this point. And I would just let everybody know that most of what we've gone through so far when we're talking about creating a group, Lisa went through every option on every drop-down menu for one screen. So it sounds complicated. It sounds like there are a lot of steps. But if you have your manual open next to you while you're working on this, you can go through and look at the charts that are in there, look at the tables that are in there, and enter in the group that's most appropriate. And it really sounds more complicated than it is. So we can continue to go through this, but I just wanted to give you a note of encouragement. It's not as complicated as it sounds, because most of you are doing community-based coalition work.
That is a great point. And a lot of this information you will already have predetermined. So I know I'm covering everything, and that's why I want to encourage you to read the manual, and then also to reach out to Ruth and or myself if you get stuck and you need help deciding which activity or which component you need to choose. But yeah, thank you, Ruth, for that. Yes, I think it is a little overwhelming, but a lot of it you have already predetermined as well. So when you're doing coalition work, your group setup will basically look the same regardless of what coalition you're working with. So if you have maybe different coalition, like maybe let's say you have a coalition and then you have a work group on that coalition, so you have two separate groups for those. The only thing that's really going to be changed is the name of your group. So hopefully that eases you a little bit. And those of you who have been using the system, hopefully you can attest to that. Once you start using it, it's user friendly. So hopefully, as you have the manual next to you, it won't be a daunting task. All right, so the main thing to remember is that you create a group in the system first, and then you create activities tied to that group. So if you have more than one section in a series, then you'll be creating multiple activities for that one group. Next. So here you'll see on your tabs options, again, you'll choose the activities, and then under that, you'll have the three. You'll either be able to add an activity, view all activities, or find an activity. And so I'll take you through adding an activity. If you want to find, of course, you just click on find, and then you put what type, follow the criteria of what type of activity you're looking for. If you want to view all your activities, then if you click on that, every activity that you've entered into your program or your organization has entered into the system will come up, and then add an activity. So creating activities, I tried, you probably would have been even more overwhelmed. Okay, so I tried to put the whole screen, the activities screen, and it's like, so it was really blurry and I couldn't get it. So if I'm able to, I'll try to do some screenshots after this to add to the PowerPoint, but as is today, I wasn't able to do those screenshots. I tried to put them in there, but they were just too blurry, and so you weren't really able to see. But the activity name will automatically populate with the group name. And then, so a lot of the stuff in the activity will auto-populate with basically what you entered in the group. And then you'll have a start date and end date that you'll put in there. Typically, it's the same day. Most activities, I honestly don't know why I can't remember the rationale behind having a start date and an end date, because I can't think of any activities that actually cross that you would do overnight. But so you just have to enter that date twice, and whatever start time and then an end time. And then your units, which is 1 unit equals 15 minutes, will be auto calculated based on your start and end time. So if you started at 3 o'clock and went to 4 o'clock, then it would show a total of 4 units. And then you would enter your total attendees. So based on the session or individual activity that you're doing, how many attendees do you have? And you would enter the total attendees in there. Next.
Lisa, I think the one and only time that I did use that start date and date where it was another date is maybe way before pandemic, when there was like a lockdown with the schools, something like that. So it was like a 12 hours, 7 p.m. to 7 a.m. So that was the only time as well that I actually was able to use that start date and date.
That's a perfect example. Thank you so much, Priscilla. Yeah, so, okay, there's an example. So then you will have new males, an opportunity to enter new males and new females. And the thing to remember about this is that when you're looking at demographics for serving people, you're only counting them once. And that's when a participant attends a group for a first time or a coalition for a first time. But the first time that they're in that service, then you would enter them as a new male or a new female. Lisa, go ahead. Lisa Simpson, I see your hand is raised. Do you wanna?
I'm sorry, my microphone wasn't on. I apologize
Oh,
for that.
there it goes.
My question is, when I'm putting in LST and I'm putting 3 units in it for one lesson, if there's enough time, because some of these lessons are short, where I do 2 lessons in one, how do I put that in? Because I don't have an opportunity to change it to 6 units. It just kind of pre-populates 3.
Right.
So the start and you would change the start and end time.
Okay, well, no, the start and end time is the same. It's just that I could fit 2 lessons into one time frame.
If you, so the units are based on time solely. So if you,
Okay,
if you do like 1 lesson during that time frame, or you do 10 lessons during that time frame, the units are not going to change.
okay. I just didn't want it to, so like if we're running reports, I didn't want it to look like I'm not teaching all the lessons, you know what I mean? Like say for 6th grade, we have 12. Well, it might only show 10, but that's because I did 2 doubles. You know what I mean? Is that okay?
Yep.
In the
So-
notes, Lisa, you can put, I was able to do this. Put
Okay.
it in that notes comment section in the
Okay,
bottom.
because I've gotten conflicting, you know, put it in again, and I'm like, well, that looks like a duplicate. That doesn't make any sense. So that was my big question on that, is how to do it. Thank you.
Yep, and you'll just want to clarify, I mean, the regional coordinator, some regions do it a little bit different, but yeah, I agree with Priscilla. That's how it's typically done, is just there's a notes section and you just enter in there, hey, I was able to do
Okay,
2 lessons today during our time period or whatever.
perfect. Thank you very much for that. I appreciate it.
Yep. And then if you, so I just wanted to reiterate with the new males, new females, because that will, the new males, new females will also is connected to the demographics. So the age, the ethnicity, and the race. So if you have someone come into your program for the first time, then that's when you will count them in new males and new females, then their demographics. However, if there is, so it's based on your service program. So if you have an individual that maybe is in your life skills program, and so you count them as new in your life skills program, and then they're also in your family program, your strengthening families program, you would also then count them new in your strengthening families program for the first time, because it's a different program. So we're trying to count how many new individuals are we servicing per group or service activity that we're doing. So sometimes people get that a little mixed up, and that would be way too confusing if you were trying to track individuals over, you know, how many, because you might service an individual in 4 different programs, and I certainly wouldn't expect you to try to monitor that. That would be insane. So just to know that the first time that they're in whatever activity that you're doing, or that you're recording information for, the first time that they're a part of that activity, then you would count them as a new female or a new male. Also to note that we know that, and we've raised the question to SAMHSA as well, that we are aware that some people may consider themselves as neither males or females or non-binary or, you know, other options. So currently we have to report new males and new females to SAMHSA, but they're looking at maybe expanding that definition to include other options. Honestly, I don't know how soon or that may materialize or if it ever will. So in the interim, we're obligated to report or collect information that we need to report to SAMHSA, which is males or females. So if you have an individual that may not identify as either or non-binary, you just have to do your best guess and best estimate of where male or female. Oh, if you could just mute if you're not talking, that would be helpful. I'm getting a little bit of feedback. So estimated people reached. This enables you to capture information about individuals that you don't have demographic information for. So if you're, working with, maybe you're doing a presentation to, 300 individuals and you don't have all of their demographic information, then you would include that under estimated people reached. And then there'll be a spot where it says first activity in group. The first activity that you enter will automatically say yes here. So this is here in case maybe you enter an activity and then you put in the wrong, let's say you enter the wrong date. And so then you want to go back and you have an earlier date that was actually your first activity. When you enter that earlier date, then you can say, okay, this is the first activity in the group. And then it will automatically number all of the other activities after the first activity. So it'll say 1, 2, 3, 4, 5. Otherwise, what was happening is that when you entered the group, no matter what the dates were, it wouldn't conform to numbering the activities in sequential order with the dates. Attendees completing group. This is an important component to understand, because I think this has probably been one of the most misunderstood components of our activity system. So attendings, what we're really looking at are participants who have successfully completed the required number of sessions for any one group or curriculum. So if you're doing a bottom life skills and it's 12 sessions long, and in order to complete the group, it's recommended that they attend at least 10 of the sessions. So then you would have to keep track of how many individuals actually completed that group, how many actually attended 10 or more of those sessions. And then at the end of the group, you would enter in attendees completing group, however many. So the attendees completing group cannot be more than the new males or the accumulative new males or females in a group. So if you get an error message that says, something like, hey, you can't enter this number of, completing group, that's why it may be that you're trying to enter more than who you've actually identified were in the group to begin with. Megan, go ahead.
So we have some staff that they'll set up a table in a lunchroom, and this has been a discussion that we've had a little back and forth with what do they count? Do they count the students like for new males, new females? Or do they do estimated people reach? Because they have a table set up with all their prevention materials. So do they count the people that they're actually talking to that come up to the table? Or do they count like how many students are in that lunchroom?
So if you're actually providing, I would count the students that are actually coming up and having conversations with you, because that's the service you're providing. If you're disseminating information to them, certainly if you're Yeah, let me think this through, because I would count the individuals that are actually coming up to me if I know their demographics. If I don't, like if I'm not, if, you know, it may be chaotic, it may be a little crazy, and we don't really have a mechanism of counting how many new males and how many new females, you know, what age group we think they are, what ethnicity we think they are. If there's not a way to record those demographics, then I would count it as estimated people reached. And I would consider, unless you have like big posters, you know what I mean, big poster signs and other things that are happening where people can just come up and not necessarily have to interact with you. I would only count the individuals that actually probably came up and interacted with me. But if there's, because estimated reach is really thinking about also that broader. So all of those kids in that classroom or in that cafeteria may have been exposed to your table if you have like, you know, huge signs or, you know what I mean? So, I mean, I think it's kind of a little bit discerning on your end on what you think makes the most sense. Like, who did I actually reach by providing that service? Was the target really focused on those individuals that were coming up? Or did we have, you know, the maybe big posters or big signs or a message that we wanted all of the students to see, even though they may not have individually came up and engaged with us? I think that if that was the design, then you could include a greater number in the estimated people reached, because they were walking by your table, they were seeing your, you know, big messages. So I didn't really answer the question, but I think it could go either way.
Thank you. That's, we've just, we've had discussions back and forth. So I just wanted to know your opinion on that. Thank you.
Yeah. Yep. Yeah. Yeah. Again, I think it's just really thinking about, okay, what service am I providing and who's being able to have access to that service? Because lots of times when we think about, you know, estimated people reach, we think about, you know, we did a media camp, we did a billboard, and, you know, this many people drove by it. So it's kind of that same thing in the lunchroom, as long as there's something large enough for them to actually get that information. All right, so next thing. So total new attendees, this will auto populate as activity information is entered. So it'll be off of the total new males and total new females. Then it will add up to total new attendees, and then it'll be a cumulative. I think this is the spot that it gets a cumulative. All right, I'm pretty sure it's a cumulative. Because you can't have, like I mentioned earlier, like the number completing can't be higher than the number of new attendees. And if you're doing like a coalition, then you don't have to put anything in, you just put 0 in numbers completed, because that number completed is really, we want to see how many people actually completed the service the educational service or the specific set of series service that you were providing. And then staff information, again, I was going to try to do a screenshot for this, but it's all a part of that activities, and it was just too blurry. But you'll have a staff information, you'll have the staff number will be a drop-down menu of all the staff in your organization that you've included in the system, as saying that these are the 3 staff that are going to be doing services. You know, these are the 5 staff that are going to be doing services for C3. However many staff you have in there. If you only have 1 staff, then only 1 staff member's name will show up. And then the strategy employed will auto-populate based on what you choose in your group. And then the start date and end date, the start time and end time, and the units will auto-populate based on what you already entered into the activity part of the screen. And then if you need to, though, if you need to change the activity start time for a specific staff member, then you can do that. So for instance, if you're doing a health fair and you have, you know, 2 staff so that are conducting the health fair or are participating at the health fair, then maybe the time that you're there is 3 hours, but 1 staff is only there for 1.5 hours. Then you can change, you have to manually go in and change when you enter that staff member's name, then you would manually go in and change the start time and the end time to whatever time they were there, and then change the units to however many units that they were actually there. If both staff members were there for the whole 3 hours, then you wouldn't need to change anything. You would just put 1 staff member name in, fill in, and then all the information would be there. And then make sure that you add, you select the add button to save that staff information. That's one of the things that's often forgotten, is we don't click the add button and then we go back and there's like no staff information saved. So it's different than saving the actual activity information. So it's like a save within a save. And so it's a little bit confusing. Then once you add that, then you can add, if there's multiple staff members doing the activity, then you can add the other staff members, and then you would just add them and their names and information will show up in the activity screen.
The staff member drop-down list, that's the staff members you add, right? I can't manually add.
Correct.
So that form that we filled out yesterday that we're supposed to fill out before this meeting, I shouldn't just put me, I should put the other 4 people that are part of that under Mr. Arbuckle, under the Coalition for Urban Family Development. I add everyone's name. So when I do submit stuff under the C3 grant, I'll see my name or Mr. Arbuckle, Marcel Arbuckle, like that, Lamar or something.
That's
Like I have
correct.
to
So
submit all those 4 names
so
under
we
the
need to
form.
know the user name, the person who will be entering data, and all of the staff who will be listed here, who will be conducting activities. So we need all of that information, but you can go back through that same link and add and fill it out again if you need to.
Thank you. That's what I will do after I was sat. I'm like, wait a minute. So yeah, that triggered me. Thanks.
Yep. And just to remember that you can have staff members also be users. So if you have 4 staff members and you're requiring them to all enter their own data, then you'll make sure that you have all 4 of their names under the username too. All right, next button. So participant, and we'll get into this in a minute, the participant information. I have a copy of like the age, race, and ethnicity. These numbers are the numbers in these categories must equal to the new male and new female participants and essentially to each other. So if you have, if you have 10 total new male and new females, then you should have 10 noted in the age group, 10 noted in race and ethnicity. They all should equal each other. And then you do not need to add demographics when you use the estimated reach. So this is the participants. These are how it's broken out into age group, race, and ethnicity. If they're Hispanic or Arab American, Chaldean, then under race, you would typically, unless they're one of these races as well, you would typically count them as unknown. No, I take that back. Unfortunately, the way the system is designed and these categories have to equal each other and also equal the new males and new females, you have to choose between either race or ethnicity. So for instance, if they were African American and Hispanic Latino, then under race, you would choose multiracial. And then under ethnicity, you would click them as not listed. Otherwise, what happens if you would, for instance, if you would count them under African American as 1, and then you count them under ethnicity as 1, then it would essentially count as 2 individuals and the numbers wouldn't add up. So as I mentioned, this isn't a perfect system, but we have to figure out how to work within it. So for the most part, you just have to decide, what either one, what specific race they are. If you don't know the race, you can pick unknown or other. And if they are either Hispanic or Arab American Chaldean, then you would also choose under race, you would choose unknown or other, so that they're able to add up. Next slide. So then you just want to make sure that those are all the components of the activity. And then at the end of the activity, you want to make sure that you're saving the activity. And then you can always go back and, so if you're doing an activity, or if you're doing a group that has, multiple sessions, for 8 weeks, then the first week you would enter your information. The next week, when you go in to add the second session, then you would go to add activity as opposed to, add a group. You wouldn't have to add a group again. You would just go to add an activity and choose that group to add an activity for. So the last thing I want to talk about, which I won't go over a lot, the report is probably another whole webinar in itself, and maybe I might consider doing that at some point. But you do have the option in your or the permissions, if you are a user in the system, to get activity data file report for your organization. So the region will automatically populate, as well as the provider agency. And then you can choose what report. If you want to just get report on a specific group, you can choose a group to get a report on that, which will basically just pull off all of the data that you've entered into the system for that group. You have to put in a start and an end date. If it's gambling related, which none of the C3 programs will be gambling related, but if you are doing a program that's gambling related, then you would put yes here. Otherwise, it auto defaults as no. You also, in the group, have the opportunity to create a template if there's like only specific information that you want to get from the activity data file. Then you can create a template. And like I said, I'm not going to go into a lot of details around that, but certainly that may be cause for an additional webinar if there's interest in knowing more about the report activity file. All right, next slide. So as a provider, you have access to all of your provider data for the C3. So, and that's why we have the different user IDs and passwords, because the PHPs is not going to be able to see Prevention Network's data and vice versa. So any data that you enter here under C3, if you'll have access to only the provider data that you entered for C3. So if you are also funded by a PHP to do other stuff, when you're in under your Prevention Network ID, you won't be able to see the other region's information. So you will have, though, access to your provider data, like I mentioned, specific group data. If you want to have specific staff data, when you pull out that report, it'll have a report on, which staff did what activities, how many units they were there for, etc. So then you can download the reports in Excel, and then from Excel, you can, manipulate the data however you want. You can sort and filter, etc., in order to get the information that you're looking for in your data. And also, like I mentioned, then you can create, like, once you pull up a report, then you can create a template. So if there's only specific information that you want, say you only want staff data, then you can click on the staff data components and then create a template and save that as, you know, staff data template or something like that. But I just wanted to let you know that there are, that the provider activity report is available to you as providers. That's all I got for today. That was a lot. I know we went through a lot. But as I mentioned, a lot of the information, one, you'll have access. I'll be sharing this PowerPoint with Ruth so she can share it out with you. And then two, there is a lot of information in that manual. All right, Barry, it looks like you have a question.
Sorry, it took me a second to unmute. So I was just wondering if something happens if I accidentally submit an activity and something was wrong with it or a group, typically I would contact the PHIP and ask them to reopen that activity. Would I contact you if it was under?
So you would contact Ruth, so she'll be your contact for Prevention Network. And honestly, I don't know, it's up to Prevention Network to make the determination if providers have the permission to edit groups and or activities. So some PHPs or regions allow their providers to edit activities and groups, and then others don't. So so that's probably why they probably haven't given you that permission, and they probably do like temporarily when you have to make that correction. So Ruth will be able to let you know what permissions she's giving the providers. But if you come across an issue like that and you're like, oh shoot, I can't edit it, then definitely you would reach out to Ruth and say, hey, I need this edited.
Thanks.
Yep, good question. All right, it looks like Tracy has a question.
I just want to make sure that I'm understanding it, because with North Care, I have to report out monthly and quarterly for all of our coalition coordinators. So I do access that report. Now, when this is being entered, it'll be entered as Prevention Network and not through the North Care. So it's not going to change any of the numbers, and North Care is not going to get that.
Correct.
And we do log in with the same MPDS that we're already using.
Incorrect. So for each region that you are contracted with, you have a different user ID. So Prevention Network will give you a specific user ID that you would use whenever you're entering data specifically for the C3 program.
Gotcha. Okay, thank you.
No,
it actually makes sense now, because I was like, how am I going to log in on one and then Ruth have access to it, but yet not have it being a part of our provider? Yeah. So that actually helps me out a lot. Thank you very much.
Yeah. And just to know, Ruth also mentioned at one point that they're going to make their user IDs start with a PN, so that you'll know, oh, this user name is for Prevention Network. So hopefully that'll help you as a user be able to differentiate, okay, this is my, North Care login, and this is my PN login.
Yes.
Yep. All right. We have a couple of minutes left if there's any further questions. I know that it was a lot of information and it was pretty overwhelming and pretty, how do I say, monotone and mundane. I was trying to think of, fun ways to make this webinar, but I don't think it is. But I do appreciate your questions, the interaction. I think helped me think about things, and hopefully you were able to get your questions answered satisfactory as well.
Thank you, everybody. If you didn't already, fill out that Google form so I know who to put into the system on your behalf. As we mentioned earlier, thank you, Priscilla, for pointing it out. Make sure you enter not just the person who will be entering data, but also give me the name and contact information for the staff that needs to be added as well, so you can report on who is completing those activities. If you have questions, my email address, ruths@preventionnetwork.org. Thank you, everybody, so much.
Thank you.